Noise-induced hearing loss. Implication for tinnitus. Noise-induced hearing loss (NIHL) is a common type of hearing impairment caused by exposure to loud noises or sustained exposure to moderate levels of noise over time. NIHL can have significant implications for the development and exacerbation of tinnitus, a condition characterized by the perception of sound in the absence of an external stimulus. Understanding the relationship between noise-induced hearing loss and tinnitus is crucial for effectively managing these auditory disorders and preventing further damage to the auditory system. Mechanism of noise-induced hearing loss. Exposure to loud noises, such as machinery, firearms, concerts, or explosions, can damage the hair cells in the cochlea, leading to temporary or permanent hearing loss. High-intensity sounds can cause mechanical trauma to the delicate structures of the inner ear, disrupting the function of the hair cells, responsible for converting sound vibrations into neural signals. Prolonged or repeated exposure to noise can result in cumulative damage to the cochlea and auditory nerve, leading to progressive hearing loss over time. Relationship between noise-induced hearing loss and tinnitus. Noise-induced hearing loss is strongly associated with tinnitus, with many individuals experiencing both conditions concurrently. The exact mechanisms underlying the relationship between noise-induced hearing loss and tinnitus are complex and multifactorial. Damage to the hair cells in the cochlea, reduced auditory input, changes in neural activity, and central auditory processing deficits associated with noise-induced hearing loss can contribute to the perception of tinnitus. Individuals with noise-induced hearing loss may experience tinnitus as a compensatory mechanism to fill in the auditory gaps caused by the loss of sensitivity to certain frequencies. Contributing factors. Several factors may influence the development or exacerbation of tinnitus in individuals with noise-induced hearing loss, including severity and duration of noise exposure. Higher intensity and longer duration of noise exposure increase the risk of cochlear damage and subsequent tinnitus. Frequency and pattern of noise exposure. Exposure to specific frequencies or patterns of noise may result in selective damage to certain regions of the cochlea, leading to tinnitus perceptual characteristics associated with the affected frequencies. Individual susceptibility. Genetic factors, pre-existing hearing loss, age, and comorbid medical conditions may influence an individual's susceptibility to noise-induced hearing loss and tinnitus. Impact on quality of life. Noise-induced hearing loss and tinnitus can have significant impacts on an individual's quality of life, affecting communication, social interactions, emotional well-being, and overall functioning. Individuals with both conditions may experience increased frustration, anxiety, depression, and social isolation, leading to reduced participation in activities and decreased quality of life. The combined effects of noise-induced hearing loss and tinnitus can impair cognitive function, exacerbate mental health issues, and negatively impact work performance and relationships. Prevention and management. Prevention of noise-induced hearing loss and tinnitus is essential and can be achieved through various strategies, including avoiding or minimizing exposure to loud noises, using hearing protection devices, such as earplugs or earmuffs, in noisy environments, implementing engineering controls and workplace regulations to reduce noise exposure levels. Management of noise-induced hearing loss and tinnitus may involve a multidisciplinary approach, including audiological evaluation, counseling, sound therapy, cognitive behavioral therapy (CBT), pharmacotherapy, and other interventions tailored to the individual needs and preferences of affected individuals. In summary, noise-induced hearing loss is a common cause of tinnitus, with exposure to loud noises, leading to damage to the cochlea and auditory nerve, and subsequent changes in neural activity associated with tinnitus perception. Understanding the relationship between noise-induced hearing loss and tinnitus is essential for implementing preventive measures, providing early intervention, and effectively managing these auditory disorders to improve outcomes and enhance quality of life for affected individuals.